This is Bashar Qumseya, Associate Professor of Medicine at the University of Florida. I would like to thank GIE for their invitation to discuss our upcoming article, which will be entitled Systematic Review and Meta-Analysis of the Prevalence and Risk Factors of Barrett's Esophagus. We all know that Barrett's esophagus is a premalignant condition predisposing patients to esophageal adenocarcinoma. And we also know that the incidence of both Barrett's esophagus and esophageal adenocarcinoma has been on the rise. There are several risk factors for Barrett's esophagus which have been identified, including GERD, family history of esophageal adenocarcinoma or Barrett's esophagus, obesity, smoking, male gender, white race, among other risk factors. However, we have scarce data on whether these risk factors have an additive effect, meaning if somebody has more than one risk factor for Barrett's esophagus, does their risk of having the disease go up accordingly? And therefore, we decided to look at this in a systematic review. We used the help of an expert librarian, and we conducted a literature search and reviewed more than 2,700 available citations. Of those, we finally included 49 studies in the final analysis. Those included 47 manuscripts and 2 recent abstracts. Our final analysis included more than 300,000 individuals who have undergone endoscopy for various indications. In patients who had no identifiable risk factor for Barrett's esophagus, the risk of having the disease was low at 0.8%. In patients who had a reflux esophagus as the main identifiable risk factor, the prevalence goes up to about 3%. However, in patients who have reflux plus another risk factor like advanced age or male gender, the risk goes up to about 12%. The highest risk was seen in individuals who had a family history of esophageal adenocarcinoma or Barrett's esophagus, who also had reflux, and that risk for having Barrett's esophagus was about 23%. We also assessed the prevalence of Barrett's esophagus in patients who were referred for colorectal cancer screening, but were also offered a screening endoscopy for Barrett's esophagus. Those were mainly done in the US, and we found the prevalence of Barrett's esophagus was about 10.1%. Now, these patients also had other risk factors. Many of them were men and white, and so they are not low risk population, but they have some significant risk factors. However, they were not referred for screening for Barrett's esophagus. In 14 of the included studies, totaling more than 31,000 individuals, we were able to identify multiple risk factors for Barrett's esophagus. And so we used this data to try to assess the risk of Barrett's esophagus based on the number of risk factors. So we did a meta-regression looking at the number of risk factors as it relates to the prevalence of Barrett's esophagus, while controlling for the region of the study, the gender, and the mean age of the patients in the study. And we found that there was a linear increase in the prevalence of Barrett's esophagus as the number of risk factors increased from 0 to 4. None of the studies that we looked at had an overdue influence on the final results, and our analysis showed low risk for publication bias. In conclusion, we conducted one of the largest evidence-based studies to look at the prevalence and the risk factors of Barrett's esophagus, and we found an additive effect for the risk factors of Barrett's esophagus. We would therefore recommend based on the most recent ASGE guideline that patients with high risk for Barrett's esophagus, including those with family history of Barrett's esophagus or esophageal adenocarcinoma, or those with reflux plus other risk factors, should be considered for screening for Barrett's esophagus and esophageal adenocarcinoma. Thank you so much. Please feel free to contact me if you have any questions or concerns.